Which specialty should I choose? Wait, I think I know what to do. Let's try it out. Uh-oh. I'm joking, guys. These decisions should not be taken that lightly. It's going to be so many more years of schooling, so at least 3 and up to 6 depending on what kind of specialty you want. So that's why it's important to just take time to introspect what you like in dental school, what you may not like in dental school, and from there decide whether you want to specialize or not. Today I'm going to be talking about the different residency programs in Canada based on the specialty itself. So I'm only going to be talking about the 9 nationally recognized specialties by the Royal College of Dentists of Canada. There's definitely more specialties out there, but I'm going to be focusing on these 9. So without further ado, let's begin. So first one, it is dental public health. These specialists are going to be the one who are going to be taking part of prevention, but also control of different dental diseases in the world, but also, and more importantly, to help promote oral health. The only school that has a specialty program for dental public health is at U of T. Now the second specialty is endodontics. When you think endodontics, usually you think of root canals, so which is fair to think that they do specialize in the roots of the teeth, so anything related to the pulp. But overall, just think of root canals treatments. You're going to be doing more complex cases. And though you have 3 schools, you have Laval, you have UBC, and you do have U of T again. Third, we have the oral and maxillofacial radiology. So they're going to be the one who are going to be looking at your diagnostic images for different reasons. For one, for the diagnosis, but also after that, the management of the disease if they do have a certain disease in the oral cavity, but also in the whole craniofacial area. In Canada, there's only one school that offers this specialty, which is at U of T. So the fourth specialty is oromaxillofacial surgery. They are going to be the oral surgeons. They're going to be the one who are doing the surgeries related to the jaw, teeth, mouth. A lot of people may think oral surgery is related to extraction of the wisdom teeth. Yes, they can do that. They also do cleft palate or cleft lip reconstruction. So it's a very broad field that you can specialize even further later on after graduating the OMFS program. We do have 6 schools that offer the OMFS program. Some of them are 4 years, some of them are 6 years. The only difference is that you get an MD degree after the 6 years program. In terms of schools, we have Dalhousie, Western, McGill, Laval, Manitoba, and also U of T. The fifth one is oral medicine and pathology residency. This specialty you can think of a pathologist, but more specialized in the oral cavity. Anything related to the diagnosis of different diseases within the mouth through many means. You do have microscopic examination, so you look at what's in the mouth, what you can see, and after that you do have microscopic examination, so whether it is a biopsy, whether it is a histology slide. And there's only 2 schools that offer this specialty. There's UBC and there's U of T. Next specialty is orthodontics. A lot of people like myself have gone through ortho treatments. So basically we had braces, but other people also had Invisalign, which is a clear aligner. They do correct the misalignment of your teeth, but they also can help with the malposition of your jaw. So you do have a lot of options. You can go to Alberta, Manitoba, U of T, Western, UDM, and also UBC. Now we're going to talk about pediatric dentistry. They're the dentists who are going to be providing care to, as the name says it, the pediatric population. So it ranges from infant, children, but also adolescents. So the pediatric population is very different from the adult population. That's why we may need a specialization in order for us to better treat those patients. So for peds, you do have a couple schools. You have UBC, U Manitoba, UDM, and U of T. So now we do have periodontics. Periodontists specialize in treating different structures surrounding the tooth, which we do call periodontium, which include the alveolar bone, periodontal ligament, the cementum, and for sure the gingiva. Some people may have already received different treatments from the periodontist, such as gum grafts. And for perio, you do have a lot of options regarding the residency programs in Canada. We have Dalhousie, Laval, U of T, U of A, UBC, and Manitoba. Last but not least, we do have prosthodontics, which is essentially the restoration of the teeth of your mouth. You can think of them as the specialists who know the best regarding dentures, crowns, bridges. If you want to be a prosto, where do you go for that specialty? We do have a couple here in Canada once again. You have U of T, University of Manitoba, and UBC. And that's all for the 9 specialties. And let me just make it clear, these are the 9 specialties that are recognized by the Royal College of Dentists of Canada. There are many more specialties that are not included, such as dental anesthesiology, orofacial pain, and much more. For each specialty, I try to give you a very general summary of what their job entails, which is not the exhaustive list of everything that they do. But if you do want to know more about certain specialty, just let me know. I'll try to go more in depth. If you do want to specialize, I do hope that this quick guide for the different residency programs in Canada can be useful for you. And that's basically it for me today. I will see you guys in the next video. Peace.